How to get rid of eye folds on the inner corner. I'm of Asian descent, 21 years old, and I want to get rid of these eye folds that are covering my inner corner. When I pinch the skin between them, they disappear and it looks better when I take a photo. I don't like the eye folds because they ruin every good picture. Is there any way other than eye surgery? I just want to get rid of the folds.
Thank you for your question. You stated in your question that you're 21 years old and that the inner corner of your eyes bother you in a way that you feel ruins every picture. And in the photos you submitted, you actually pinch the space between your nose, over the bridge of your nose, to expose more of the inner corner. And you feel like that's the goal, and you want to clearly learn more about your options. Well, I can certainly provide you with some guidance. I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial, plastic, and reconstructive surgeon, practicing in Manhattan and Long Island for over 20 years. And Asian eyelid surgery is an area of expertise in my practice, and we treat patients who come to us from around the world. So, when it comes to this question, first, what you're describing is a variation on an anatomic feature called an epicanthal fold. And the degree of and the classifications of epicanthal fold help determine the type of surgical options that you can consider. Now, from just a broad perspective, I would say that your epicanthal fold is not as significant as people who have less of what's called the lacrimal lake, or the area of the inner corner which gets partially covered naturally by an epicanthal fold. So when you expand the space over the bridge of your nose by pinching the skin and you bring the corners in closer, I have to say that it was a little bit exaggerated, and I'm sure you're doing that on purpose to try to demonstrate what your desired outcome is. Basically, there are two ways to accomplish your goal, but you have to also be aware that there's a downside to both options. Well, when you first begin with pinching your nose, you notice that when you elevate the bridge of your nose, that more of the inner canthus can be seen. Now, that means that an option that some people have taken is a rhinoplasty, where a material, usually in this country it's cartilage, outside of this country people place very commonly silicone implants to raise the bridge of the nose, and that can help balance things out. The other procedure is called epicanthoplasty. Now, epicanthoplasty, depending on the type of procedure, the type that I would consider on you would be a more conservative procedure, is basically making a set of incisions around the epicanthal fold, and it's essentially movement of skin to allow exposure of the lacrimal lake, and that way elongate the width of the eye. The reason that I'm hesitant is that in a 21-year-old, I would be concerned about the scars. And although it is routine to do a combination of epicanthoplasty with upper eyelid Asian blepharoplasty, I would still question whether it's justifiable in your situation. There have been patients who have come to us where they really wanted that particular procedure, and the initial process was a challenge because after the procedure, those scars can get a little thick. They may need some tender loving care, TLC, and some management and some aftercare. But you have to think about the motivation. Are you willing to accept a certain risk for scars compared to the way you appear? And so I think that that's a very important detail, and the relative risk of scarring has some dependency on the type of skin you have. So I recommend you meet with doctors who perform epicanthoplasty and learn about your options. But I would say that from the photo you submitted, that enough of your lacrimal lake shows that I would probably dissuade you from pursuing surgery, because I think that extra millimeter or so that you could see of the inner corner is not going to justify the risk of scars. And I also think that from a subjective perspective that you may be over interpreting what you describe as ruining the pictures. And so I think learn more, meet with doctors, and learn about the options and the risks before you pursue any further or commit to having a procedure done. So I hope that was helpful. I wish you the best of luck. Thank you for your question.